Welcome to my live stream lecture. And before we get into this morning's requested lecture, please hit that subscribe button and hit that notification button. Support my channel, subscribe to my channel. And with that being said, let's get down to today's lecture. Like I stated, this is a requested lecture. I had a very in-depth conversation with one of my subscribers in the real world. The audience is aware I spend a lot of time in the trenches talking to people, just finding out how their day was. They may share with me a recent video of mine that they may have watched. But one of my 35-year-old subscribers requested that I do a lecture on hand sanitizer, aka the hidden addiction. Hand sanitizer, aka the hidden addiction. He shared with me that he is been in recovery from being addicted to hand sanitizer for 7 years, and he stated that awareness really needs to be done about this. So pay attention. First of all, if the audience is aware, I'm a licensed clinical addiction specialist. I have been credentialed in the field of addiction as an expert for over 24 plus years. I supervise other credentialed counselors, addiction counselors who work in a residential substance abuse treatment program. I clinically supervise that program. I clinically supervise those counselors. And I'm here to tell you, I am in the trenches. This is real. We have people right now where their primary drug of choice is being addicted to hand sanitizer because it's a high percentage of alcohol in hand sanitizers. So pay attention. Federal health agencies warn against drinking hand sanitizers as a way to get drunk. Drinking hand sanitizers can be dangerous and may be a sign of alcohol abuse or addiction. People who abuse alcohol may drink a variety of alcohol-based substance. Another good example of an alcohol-based substance is mouthwash. There is a high percentage of alcohol in mouthwash, and yes, people drink this to get the impaired effects from the alcohol. If they are unable to access traditional alcohol beverages or have become addicted to alcohol. Other examples of alcohol-based products, like I stated, the mouthwash, the hand sanitizer. This particular hand sanitizer has 65% alcohol in this bottle. That is a high percent of alcohol. This mouthwash has 30% alcohol in this mouthwash. Other alcohol-based products is disinfectants, antifreeze. In August of 2020, the Center of Disease Control and Prevention released a new report highlighting the adverse serious effects that come from ingesting alcohol-based sanitizer, including alcohol poisoning and death. Is there alcohol in hand sanitizer? Hand sanitizers can contain many ingredients, including certain types of alcohol. According to the CDC, alcohol-based hand sanitizers can contain anywhere between 60 and 95% alcohol. Depending on where it is bought in the manufacturer. Types of alcohol that can be found in hand sanitizer include ethanol, isopropanol, methanol alcohol. Those are the types of alcohol found in hand sanitizer. Hand sanitizer products contain methanol alcohol are illegal. According to the U.S. Food and Drug Administration, methanol is not an acceptable ingredient in hand sanitizers, mostly due to its high toxicity. Over the course, why do people drink hand sanitizers? Over the course of the COVID-19 pandemic, the use of hand sanitizers has been strongly encouraged to prevent individuals and families from spreading or contracting the coronavirus. Health agencies have reminded individuals, however, that alcohol-based hand sanitizers should never be ingested due to serious and potential fatal side effects. This should not be ingested. Reasons why someone may drink hand sanitizers. There are many reasons why. First of all, of the high alcohol content is less expensive than alcohol beverages, easier to purchase, social pressure and experimentation, and alcohol addiction. According to CDC, children are one of the greatest concerns when it comes to drinking hand sanitizers, as they may drink it by accident or as their alcohol beverage of choice, and can be easily attained or easily purchased without checking ID. In addition, adults with an alcohol use disorder, alcohol addiction, may also drink hand sanitizers in lieu of alcohol. You know, some people who are truly addicted to alcohol, this is their drink of choice. That's one of the reasons awareness really needs to be brought to attention on this, because you know this issue has been going on for a long time. This is nothing new. You know, as a licensed clinical addiction specialist experts, I'm in the trenches. I supervise counselors working in residential treatment programs, and I hear the stories. You gotta watch your kids, you gotta watch your teenagers, because they started as young as the age of 5 years old, getting drunk on drinking hand sanitizers. And I'm here to tell you, this is real. There are so many dangers of drinking hand sanitizers. Drinking hand sanitizers can be very dangerous, especially if the sanitizers contain methanol. The dangers of drinking hand sanitizers containing any type of alcohol, however, have been established for decades. Some of the dangers of drinking hand sanitizers ingestions can include, first of all, most importantly, alcohol poisoning, seizures, visual impairment, permanent vision loss, blindness, and death. In May of June of 2020, 15 people were hospitalized in Arizona and New Mexico for methanol poisoning behind drinking hand sanitizers after ingesting hand sanitizers products. According to state health departments, 4 of these individuals died. The New Mexico Department of Health confirmed that 7 of their reported cases, which resulted in 3 deaths, were related to alcohol addiction. In 2012, 6 teenagers were also reported dead in California after drinking hand sanitizers that contain a high percentage of alcohol, according to the local health officials. This brought national attention to the issue, and I'm here to tell you. Drinking heavy amounts of alcohol on a regular basis carries a risk of alcohol dependency and addiction. No matter where the alcohol is found, rather it's coming from the hand sanitizer, or rather the alcohol is coming from mouthwash, It doesn't matter where the alcohol is found, or if a person go to a convenience store and purchase a 6-pack of beer. Drinking hand sanitizers pose a serious risk for addiction, in part because store-bought varieties can be up to 120 proof. The higher the alcohol content, the greater the risk for dependency, addiction, and other dangers associated with heavy drinking. Also, drinking hand sanitizers may cause the following side effects: headache, blurred vision, nausea, vomiting, stomach pain, decreased coordination, unconsciousness that could lead to death. This, like I said, awareness really needs to be done on this. It's out of control. I'm in the trenches. I see it every day. You got folks right now who are patients in the residential treatment program where I'm a clinical supervisor, and our programs stay full. And I'm here to tell you, and these people are not just coming in because of their addiction to hand sanitizer or alcohol-based products, the marijuana, the cocaine, the Xanax, the methamphetamine, opiates, and it's real, and it's not, and substance abuse has not gone anywhere. I'm here to tell you, parents, significant others, loved ones, pay attention to your family members. Pay attention. There are reasons why a person cannot stop drinking or using drugs. I don't care if it's a hand sanitizer, the cocaine, the methamphetamine, the Xanax, but there are reasons why a person cannot stop their alcohol or substance use. And that reason, that powerful reason, is psychological dependency. I'm talking about the mind, people. And what psychological dependency is so powerful. And the reason why psychological dependency is so powerful, that propels that person deeper into their addiction, is because it's made up of 4 parts. And I'm going to break this thing down to you. We got state-dependent learning, we got preoccupation, we got the relationship with the alcohol or drugs, and we got the psychological defenses. And what state-dependent learning is, by the time the person, alcoholism or drug addiction has progressed to the point where now what they're going to do is they're going to now need that substance in order to get going in the morning, to perform certain tasks, skills, duty, house chores. Even if they got a job by this point, don't think they're not working at 8, 9, or 10 hours job without work or sneaking in the bathroom to consume their alcohol or drugs in order to finish the task, in order to perform the essential functions of their job, in order to complete those duties. So that's what state-dependent learning is, when the person becomes accustomed to performing certain tasks, skills, duty, job function, chores, cutting the grass, working on the car. They can only do that when they're alcohol or drug impaired. And what that does is propel them deeper into their addiction. State-dependent learning ties into psychological dependency. And then we got the preoccupation. What preoccupation is the person now becomes so mentally obsessed with their alcohol or drug use. They can be at a family function or eating dinner with a family, or watching a movie, or even at a funeral, at a cookout. Physically they're there, but their mind is more preoccupied on feeding their addiction. Their mind is more preoccupied with making sure that they don't begin to feel the symptoms of withdrawal, because the minute they begin to feel the symptoms of withdrawal, they're going to consume the more alcohol and drugs to prevent withdrawal. That's what preoccupation is, that they're so mentally obsessed on feeding that addiction. They're so mentally obsessed to make sure they don't run out of their supply of alcohol or drugs. They're even watching the clock, hoping this function will hurry up, hoping this event will hurry up, hoping this birthday party will hurry up, or this graduation will hurry up, hoping this funeral will hurry up, because their mind is so mentally obsessed on feeding their addiction, going to meet the dope man, or to sneak in the bathroom, to drink the beer, to drink the liquor. That's what preoccupation is, and it drives that addiction. It propels that person deeper and deeper into their addiction. And then we got the relationship with the alcohol or drugs. The person may, at this stage of the game, may have damaged healthy relationships with the mother, father, sister, brother, significant other, the employer. What happens at this stage of the game, they formulate a relationship with the alcohol or drug of choice. They formulate a relationship with the hand sanitizer, or with the mouthwash, or the cocaine, or the marijuana, or the methamphetamines, or the Xanax pills, or the opiate pills. They now have formulated a relationship with the alcohol or drug of choice. They're going to do everything they can to protect the true severity of their addiction. They're going to lie about the severity of their use. They're going to lie to significant others, loved ones, mother, father, sister, and brother about, hey, I'm not using, ain't nothing wrong with me. They're going to formulate a relationship, and they're going to lie about the severity of their addiction. In that relationship with the alcohol or drug of choice is going to propel the person deeper and deeper into their addiction. And then we got the psychological defenses. Psychological defenses is like a powerful shield to keep you from hearing the truth. Family members, loved ones, significant others, mother, father, sister, brother, they may approach the person. And they may say to the person, I'm concerned about your behavior. I'm concerned about your alcohol or drug use. I'm concerned about your lies and manipulation. I'm concerned about that you're missing out on family events, birthdays, cookouts, graduations. I'm concerned about what I see. Inside, the person know what they're doing is wrong. Inside the person, they know they need help. But because psychological defenses are so powerful, it's like a powerful shield to keep you from hearing the truth. So they may respond to that family member in a defensive way. And the reason why they do that, because they know inside of them that the addiction is out of control. So ladies and gentlemen, that is the reason why a person cannot stop their alcohol or drug use, because of the power of psychological defenses, the power of psychological dependency in those four parts. The psychological defenses, the relationship with the alcohol or drugs, the preoccupation, and the state-dependent learning. We're dealing with the mind, people. That is the reason why they cannot stop. At this stage of the game, because the alcohol abuse and addiction, these are the reasons why they cannot stop. At this stage of the game, the only choice at this point is they're gonna need professional help. They're gonna need medical detox. They're gonna need inpatient treatment in order to get the skills to attain sobriety, to maintain sobriety. There is help out there, but at this stage of the game, the individual is going to need substance abuse treatment, medical detox by the experts, because it don't matter what the drug of choice is. I don't care if it's the hand sanitizer. I don't care if it's the mouthwash or the liquor, the alcohol, the Xanax, the marijuana, the nicotine. Yeah, nicotine's a drug. The opiate pills. I don't care what the drug of choice is. By the time a person reach full-blown addiction, at the tail end, hear from an addiction expert, it is not a pretty sight. Research has validated people with alcoholism or drug addiction, they die prematurely 25 to 30 years earlier than an individual who does not suffer from the disease of addiction. So ladies and gentlemen, I wanted to bring awareness to this. This thing is real. I'm here to tell you. This thing is real. Send me your comments, send me your questions. I hope you all got something out of this lecture in terms of the hand sanitizer, aka the hidden addiction. It truly is a hidden addiction. I do substance abuse evaluations. I've done substance abuse evaluations in this game for a long time, and I've noticed a pattern over the past several years that the age of onset for a person addiction, it doesn't matter what their drug of choice is, But the age of onset, I'm beginning to hear people say, oh, I started drinking alcohol or start drinking hand sanitizers to get high, or started smoking marijuana or smoking cigarettes at the age of 5. At the age of 5 years old, that's when they begun with their alcohol or drug addiction. So by the time they hit the age of 10, they got 5 hard years of addiction under their belt, the age of 5. And I'm hearing this more and more and more and more and more by thousands of evaluations I've done on people, and some even younger than that. Enough is enough. So with that being said, please don't forget, hit my subscribe button, hit my notification button, and also, if the audience is aware, my publishing company recently completed a powerful video trailer to market my book, Awake Financial Freedom. This is a must-read book. There is a spiritual base to this book where I share with the reader on literally how I rose from financial destruction to complete financial freedom. There is a particular chapter in here where I share with the reader the strategic way on how I literally raised my credit score from a 340 to an 800 plus. There was a strategic method I used, and it worked for me. It raised my credit score with all 3 major credit bureaus, Equifax, TransUnion, and Experian, and I accomplished that tremendous feat in less than 1 year, from a 340 to 800 plus credit score, and it's all laid out in Awake Financial Freedom. So with that being said, that's all I have. Subscribe to my channel right now. Support my channel, support my book. With that being said, simplify, simple fidelis, and I'm going to leave you in the care of your own conscience. Have a great evening.